Hello, this is Dr. Wells with Wells Medicine, and I wanted to do a video about safety with regards to ketamine clinics. So, there are some safety guidelines that are officially published. In the state of Texas, we have the Texas Medical Board office-based anesthesia guidelines that specifically call out the IV administration of anesthetic agents, naming ketamine. And then there are guidelines to follow to create a safe office-based anesthesia environment that are listed in that office-based anesthesia Texas Medical Board approved document. So, for example, we are required to have advanced cardiac life support training, ACLS. We are required to have a second person in the office that has BLS or basic life support training at all times. There should be 2 people in the office. There is required to be an advanced cardiac life support cart with basic advanced cardiac life support medications, such as epinephrine, single dose vials of potent steroid, medications for heart rhythms, such as amiodarone, antiarrhythmics like lidocaine, and medications for allergies such as Benadryl. We're required to have a properly working AED, which is a device used to shock a heart rhythm back into a proper rhythm. We're required to have a plan for how to contact emergency support services. We're required to have a plan for various emergency scenarios, like a bomb threat in the office or a environmental catastrophe. So there are some safety measures that are completely written down and provided for us by the state because of the IV administration of ketamine as called out by, these documents. But then there are some safety measures that, having done this for 10 years, are very common sense, and offices providing ketamine services should have those safety measures as well. So, for example, all of our rooms have a doorbell so that patients can reach us at any time, can without having to use kind of advanced mental skills of language and vocabulary to alert us that, with the press of a button, that they are feeling like they want someone to sit with them, or they want someone to change the music, or they want someone to change the angle of their chair, or they want someone to adjust the dosage, and kind of alerting us that they want someone there with them, which we encourage them to use even when they have family members with them. We have a very computer guided administration system that continuously delivers the dose at a set rate. So I'm aware of some clinics out there that just use 1-liter bags dripping to gravity, but that can be affected by patients moving their arm and bending or allowing a freer flow of medication. It can be affected by the height of the bag, by the height of your heart relative to the bag. Having it be delivered at a very set rate means that we have a lot of control over how the administration of the medication goes versus having it just be dripping, at whatever rate, which can create a very bumpy experience. We are very, very careful with the measurement of the medication, using TB syringes or tuberculosis syringes, which are 1 millimeter syringes to measure out the medication. I'm aware of some clinics that use slightly larger syringes, 3 milliliter syringes. Some even use 5 milliliter syringes, which have less tightness of dose range. we are very, very careful to titrate our infusions to the effectiveness for the patient, as opposed to just using a standard zero 0.5 milligrams per kilo, or I'm aware of some clinics that use always 0.75 milligrams per kilo, or even always 1 milligram per kilo, which can be too high for some sensitive patients. That doesn't give a lot of flexibility to changing the dose for how variable the patient's experience is. I think for safety reasons, it's very important to always, have that second person in the office, to always be able to have someone there with certifications and with training. The Texas Medical Board requires advanced airway training. I've never seen an airway emergency with ketamine, although I am aware from being involved in the ketamine community that there have been at other clinics airway emergencies. I think it's also important to have the equipment ready to measure blood pressures, because I've definitely seen blood pressure be too high or too low before even starting the administration of ketamine, let alone after administering ketamine, and to have medications available to raise or lower blood pressures as needed, and to have the expertise of being an anesthesiologist for so long, and in my normal line of work, raising and lowering blood pressures and knowing what an appropriate and safe blood pressure is for patients. I think it's important to have the oxygen monitoring capacity. We almost never use extra oxygen on patients, but it is good to have the capacity to monitor oxygen levels on patients. Sometimes with our pain patients, when we're having to use sedation, we have had patients who needed a little bit of extra oxygen, so it's important to know when that happens. I think it's really important to have the capacity to measure EKG and to know what a normal EKG looks like. We don't always measure EKG in our patients, depending on the dose of the medication and depending on the health status of patients. But we have some patients who come to us with fairly significant cardiac histories, and I think it's important to be able to measure the EKG and know what a normal EKG looks like when you're treating patients with those histories. With a medication as powerful as ketamine can be. I think it's also really important to have an administration dosing expertise as well. Through my work as an expert witness in the ketamine administration community, I have been made aware of some cases where patients have received 10 to 100 times the dose that they were supposed to receive, based on providers not being familiar with how to draw up, measure, create a dose range for patients in milligrams per kilogram, translate mathematically pounds to kilograms, to use the dilution in the bottle versus the amount that you draw up. So I think there is an expertise in knowing how to do that that I think is a safety feature as well. So those are some of the things that we look for as safety features. I think it's important to look at the credentialing of the provider and to look at the office structure, and to make sure that they're following guidelines that have been published, like the Texas Medical Board office-based anesthesia guidelines, to make sure that you're receiving ketamine, which can be a very powerful medication, in the safest location possible for receiving this powerful medication.